Tendonitis. Okay, I'm going to start with the wrist first of all. I type a lot. I'm at a desk a lot of times, and I developed this wrist pain here mostly from doing push-ups. I did push-ups like this, then I did them like this, and I injured myself last fall. It's now February, and I injured it like 6 months ago. The pain went away after about 4 or 5 weeks, and now it returned because I'm doing more push-ups. And the pain has been really bad in the morning and then certain times at night. I've done a lot of research on wrist tendonitis, wrist issues. What I have is actually not carpal tunnel syndrome. It is wrist tendonitis. From watching the other videos and everything I've tried online, here's what I recommend if you got pain in this. You got wrist pain, here's what I want you to do. Number one, adjust your position in bed. If your wrist pain is on this side, well, you may want to sleep on that side during the night, okay? Sleep on the other side. Number two, in the morning, I want you to put it in hot water. Cover up your entire arm from here to here to here, as hot as you can take it, and soak it for 4 minutes, okay? Then take it out, and I want you to put it in cold water as long as you can and soak it for 1 minute. Then I want you to take a shower and get ready, and throughout the day, I want you to find those points in here where it's sore. If your wrist pain is here, the source of it is because your tendons are tight up in here. Your muscles, your ligaments, your tendons are very, very, very tight. That is causing your wrist to lock up. So you got to be working this all day long. And this is what I've been doing now for a week and a half. And I've got 80% improvement. So all the anti-inflammatories I've been taking, the painkillers, that's not going to solve the problem. It is getting these ligaments and these tendons here to stop being inflamed. And the heat and the ice will help with that. The massaging, the stretching, the pressure points will all help with that. I do recommend chiropractics to take a look at it. I've been going to chiropractor this week, and he's been helping with it as well. And then, of course, it's just rest and time. You know, if your wrist hurts, well, don't friggin' use it. Like, give it a break. Put it in a brace if you want. For me, the brace is not helpful. It just makes it more stiff, so I've kept it off. I just forget about it. So those are my recommendations. And the only other recommendations is to take some supplements, which you can research online. I'm not going to really talk too much about that. So it's rest, it's heat, it's ice, it's massage, it's pressure points, it's loosening up whatever is exacerbated in there. All right, on to my second subject. I took a nasty fall on the ice last Saturday. It is now Thursday. I literally fell straight back onto my back. Slightly hit my head. As you can see, I'm pretty much mobile here just 4 or 5 days later. I almost got knocked out, by the way. Number one, if you ever feel like you may have a concussion, go to the emergency room right away. Don't risk it. I did not. I didn't have to do any of that. I hit my head kind of as an after effect, but I got pretty bad whiplash. So all sore in here, all the way in back. I landed right back here. So what can you do about it? Well, number one, you got to be really, really careful not to do it again. So stay off the ice. Avoid any ice. Walk very slowly. Pace yourself. Be gentle. Don't be in such a rush. Number two, if you didn't have any muscle spasms, which I didn't, really there's only a few things you could do. Rest it. Get to the chiropractor. Ice it at night. The ice is going to help with the inflammation. Take some hot baths. Do as much stretching as you can. Have a good diet. Eat lots of water. Get your sleep. And be patient with your body. It's going to take time to heal and get past such a blunt force as hitting your back on the ice or hitting your head. It's a slow recovery process. The chiropractics will help very, very much because the chiropractor is going to help release a lot of those joints and pressure on the ligaments and the muscles, and that's what an adjustment is. It's going to pop out any gases or air that's between your joints, and it's going to allow your muscles to relax. And when your muscles relax, your tendons relax, your joints relax, and you heal much quicker. And, you know, if you need to take some anti-inflammatories or some painkillers to get through your work day, then go ahead. You know, for me, I take about half of what anyone normally takes. So if I happen to leave, I'll take half of it. Just to give I don't want to overwhelm my stomach or my liver, my kidneys, or any of that. You gotta have a healthy diet. You gotta drink lots of water. You gotta get your sleep anytime you injure yourself, whether it's your wrist or your back or any of that. For your back as well, posture is critical. Posture, posture, posture. And then I guess the way I'm going to end this video here, because I'm a runner, is you got to stay active. Once you feel up to it, get active, whether it's swimming or running or biking or walking. That gets everything moving. It keeps your joints loose. It keeps your body healthy and keeps things moving. It's when you become complacent and stagnant that things tighten up. That's kind of all I have to say today. So thank you for tuning into my videos. My subject matter on my YouTube channel is pretty broad nowadays, but please subscribe. I promise you'll enjoy it. And have a great day and happy healing if you have any back issues or wrist tendonitis. If you want to, shoot me an email or message. Certainly subscribe. KimMach7 signing out. Have a great day.